And what's the reason for your visit today?
I need refill on pain medication, and I think I'm due for a mammogram.
It was in 1970, in October, and there had been sort of the height of the Chicano movement in Barrio Logan. The freeway had just gone through, which cut the community in half.
Castell, your 8:30 is the waiting area, please. Castell, 8:30 waiting area.
Do you want me to start over?
Sure.
Okay.
Finding a place at the Chase Avenue Clinic to ask Public Relations Director Jennette Shay about family health centers of San Diego's beginnings was a little tricky.
It was in October of 1970, and it was
Okay, I'll finish for her. A Barrio Logan grandmother named Laura Rodriguez took the keys for a building that was set to close, staged a sit-in, and demanded it be turned into a health clinic. It became Family Health Center's first facility. From that scrappy beginning, it's become the nation's second largest federally qualified health center, with 17 clinics throughout the county. Some of those clinics are brand new, state-of-the-art facilities. Back at the Chase Avenue Clinic in El Cajon, things are still a bit scrappy. Doctors share offices the size of walk-in closets. The conference room doubles as a break room. We're conducting our interview in a busy nurses' station.
I think it's just a lot of chutzpah, and that's sort of a characteristic of family health centers where we're just here to make it work. We're here to make sure our patients get access to care.
And it's that chutzpah that makes clinics like family health centers a cornerstone of the Affordable Care Act, which will grow the ranks of patients by 30 million nationally. They're good at doing a lot with a little.
It's been shown that we are one of the most effective and cost-efficient ways to deliver care. So if you look at the cost, it's about a third less to deliver care at a community health center setting with the same high-quality results.
What they're not so good at is attracting doctors to come work for them. There are those closet-sized offices. There's also the challenge of getting med students with elephant-sized debt to go into primary care. The federal government estimates the nation is short about 16,000 primary care physicians. But Family Health Center's Assistant Medical Director, Chris Gordon, says there's something else at work.
Interestingly, literature shows that half of the physicians stay where they train. It's independent of what that setting type is. Half of them stay where they train. And I think probably part of that has to do with being comfortable in the environment that you learned in.
And where do the majority of doctors do their residencies? Hospitals. Finding a clinic accredited for residencies is rare, but that's changing under the Affordable Care Act. The health reform law has set aside $230 million to set up residency programs in community clinics. Locally, Dr. Gordon and family health centers are leading the charge. They're applying to bring 6 resident physicians into their City Heights facility next year. Gordon and others are betting that if doctors start their careers in community clinics like this one, they'll stay in community clinics. That was Gordon's experience. He came to family health centers 4 years ago after training in Riverside County health clinics.
I think the reason why most of us are working for family health centers is because we believe in the mission. We want to take care of the underserved. We're interested in assisting with bridging the gap of disparities in healthcare between those that have had insurance all of their lives and those that don't.
Gordon and Jennette Shay insist they'll be ready when the Affordable Care Act starts to close that gap next year. There might still be a doctor shortage, but family health centers started with much less, an empty building and the chutzpah of a Barrio Logan grandmother. Megan Burks, KPBS News.